5 on your health. GLP-1 medications have changed the conversation around diabetes and weight loss in adults.
Now, Novo Nordisk, the maker of Ozempic, says it's seen promising results using an oral form of semaglutide in children and teens with type 2 diabetes. If approved, it could become the first oral GLP-1 treatment available for younger patients.
Joining us live is Dr. Scott Hadland, Chief of Adolescent and Young Adult Medicine at Mass General Brigham. Thanks for being here with us. So help us understand what exactly has been announced. Is this about weight loss, type 2 diabetes in children? Is it both in kids?
Yeah, this is about type 2 diabetes in children. And as you mentioned, this is semaglutide, which is the most commonly known GLP-1 agonist that, the brand names are Ozempic and Wegovy. I think people have really, heard of these medications. And there is this new formulation for adults called the Ozempic pill that's about to come out. This is an oral version of the pill. Up until now, these have been injections. And so this is significant because this is a study of the oral pill semaglutide in children under age 18, specifically for the treatment of type 2 diabetes. But this matters because what we saw in the adult side of things is that, and actually in the, with pediatric trials too, is that often what happened is the indication for type 2 diabetes came first with approval from the FDA. And then after that, we saw as the drug manufacturers sought approval for these medications for weight loss. And so we may yet see that with this oral pill.
All right, so Dr. Hadland, why this type of medication and not something else?
Well, there are other medications to treat type 2 diabetes in children and adolescents. We commonly use medications like, for example, metformin, folks may have heard of. We also encourage lifestyle changes. And in some patients who have more severe diabetes, they may need insulin. This is really significant because we know that these medications, these GLP-1 agonists, are very effective treatments for diabetes. They're very effective at inducing weight loss. They seem to be very protective in the long term at protecting downstream problems like heart attacks and strokes during adulthood. And so this could be a very, important game changer in the treatment of diabetes in young people.
And Dr. Hadland, just to follow up on that, correct me if I'm wrong, but these were originally approved for diabetes in adults, right? The diabetes treatments, and then they kind of had this weight loss side effect. Am I right about that in my recollection?
That's exactly it. That's the story here, right? That these medications start off as diabetes medications, first as injections, then as pills. And what we keep finding is that because they also induce this weight loss, this FDA approval for them as use for weight loss medications has followed, first with the injectable medications and now with the oral medications for adults. And so what we're seeing here is the first time that these medications are approved potentially or could potentially be approved based on these new study findings for the treatment of diabetes in children, this oral pill. And so we may yet see that the weight loss indication is soon to come in children as well.
So my understanding is with the weight loss, at least, you have to continuously take this. You can't just, once you lose the weight, go off of the drug. So what are the biggest, and I assume with the diabetes as well, so what are the biggest questions doctors have about the long-term use of these medications in young people?
Yeah, I think you mentioned a key one, right? What happens in the long term? How long do you need to stay on these medications? Is there the potential that you could come off them at some point? I think the other consideration is, these studies haven't looked at very long-term treatment in young people. These are new medications, so we don't know what these look like 5 to 10 years down the road when young people are on these medications for years on end. So that's the thing that we doctors will be looking to. And then, of course, there's the question about, are they affordable, right? We know that these are very expensive for insurance companies, that insurance companies have actually increasingly stopped covering these medications for weight loss. And so as this medication becomes potentially available for diabetes later on this year, and at some point in the future, potentially for weight loss as an oral pill, will insurance cover it, and what will families have to pay out of pocket? These are key questions.
Yeah, a lot of questions remain. Dr. Scott Hadland, good to see you. Thanks for your time. Have a good weekend.
Same to you.